Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about type 2 diabetes in children. So if you like the video related to my health, I would like to request you all please to subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. For decades, type 2 diabetes was considered an adults only condition. In fact, type 2 diabetes was once called adult onset diabetes. But what was once a disease mainly faced by adults is becoming more common in children. Type 2 diabetes is a chronic condition that affects how the body metabolizes sugar, also known as glucose. Between 2011 and 2012, about 23% of new diabetes diagnoses in children trusted sources were type 2 diabetes. Until 2001, type 2 diabetes accounted for fewer than 3% of all newly diagnosed diabetes cases in adolescents. Studies from 2005 and 2007 show type 2 now comprises 45% of those diabetes cases. Causes of type 2 diabetes in children. Being overweight is closely tied to the development of type 2 diabetes. Overweight children have an increased likelihood of insulin resistance. As the study struggles to regulate insulin, high blood sugar leads to a number of potentially serious health problems. Obesity in American children and adolescents has more than tripled since the 1970s, according to the Center for Disease Control and Prevention. Genetic may also play a role. For instance, the risk of type 2 diabetes increases if one parent or both parents have the condition. Symptoms of type 2 diabetes in children. Symptoms of type 2 diabetes are not always easy to spot. In most cases, the disease develops gradually, making the symptoms hard to detect. Many people don't feel any symptoms. In other cases, children may not show any. If you believe your children has diabetes, keep an eye out of for these 6 symptoms. The first one, excessive fatigue. If your child seems extraordinarily tired or sleepy, changes in blood sugar may be affecting their energy level. Second, frequent urination. Excessive sugar level in the bloodstream can lead to excessive sugar going into the urine, which is followed by water. This may leave your child running to the bathroom for frequent restroom break. Third, excessive thirst. Children who have excessive thirst may have high blood sugar level. Fourth part, increased hunger. Children with diabetes don't have enough insulin to provide fuel for their body cells. Food becomes the next best source of energy, so children may experience hunger more frequently. This condition is known as polyphagia and hyperphagia. Then it comes to fifth part, slow healing sores. Sore or infection that are resistant to healing or slow to resolve may be a sign of type 2 diabetes. Sixth part, darkened skin. Insulin resistance can cause skin to darken, most commonly in the armpit and neck. If your child has type 2 diabetes, you may notice areas of darkened skin. This condition is called acanthosis nigricans. Now I'll be talking about the diagnosis. Type 2 diabetes in children require testing by a pediatrician. If your children doctors suspect type 2 diabetes, they all likely perform a urine glucose test, a blood glucose takes a glucose tolerance test, or an A1C test. Sometimes it takes several months to get in type 2 diabetes diagnosis for a child. Risk factors. Diabetes in children is most common in those aged 10 to 19 years. A child may have increased risk for type 2 diabetes if they have a sibling or other close relative with type 2 diabetes. They are of Asian, Pacific Islander, Native American, Latino, or African descent. They show symptoms of insulin resistance, including dark patches of skin. They are overweight or obese. Kids with a body mass index above the 85th percentile were around 4 times as likely to be diagnosed with type 2 diabetes, according to one 2019 study. Current guidelines recommend that testing for diabetes be considered for any child who is overweight or obese or has at least one additional risk factor as listed. Now I'll be talking about the treatment. Treatment for children with type 2 diabetes is similar to treatment for adults. The treatment plan will vary according to the growth, need, and specific concern of your child. Learn about diabetes medication here depending on your child's symptoms and medication needs. Teachers, coaches, and other people who supervise your child may need to know about your child treatment for type 2 diabetes. Talk with your child doctor about a plan for the time when they are in school, for otherwise away from you. Now I'll be talking about the blood glucose monitoring. Daily blood sugar monitoring at home will likely be important to follow your child blood sugar level and watch their response to treatment. A blood glucose meter will help you check these shop for a blood glucose meter to use at home. Now I'll be talking about the diet and exercise. Your child doctor will also give you a new child dietary and exercise recommendation to keep your child healthy. You all need to pay careful attention to the amount of carbohydrate that your child takes in during the day. Participating in improved and supervised form of physical exercise every day will help your child stay within a healthy weight range and lessen the negative effect of type 2 diabetes. Potential complication. Children with type 2 diabetes are at a greater risk for serious health problems as they grow older. Vascular issues such as heart disease are a common complication for children with type 2 diabetes. Other complications such as eye problem and nerve damage may occur and progress faster in children with type 2 diabetes than in those with type 1 diabetes. Weight control difficulties, high blood pressure, and hyperglycemia are also found in children with the diagnosis. Weakened eyesight and poor kidney function have also been found to occur over a lifetime of having type 2 diabetes. Last, not the least, the outlook of this. Since diabetes is sometimes harder to diagnose and treat in children, the outcome for children with type 2 diabetes are not easy to predict. Type 2 diabetes in young people is a relatively new issue in medicine. Research into its causes, outcome, and treatment strategies still ongoing. Future studies are needed to analyze long-term consequences of having type 2 diabetes from youth. Now, how to prevent type 2 diabetes in children? You can help children avoid diabetes by encouraging them to take the following step. Practice healthy habits. Children who eat well-balanced meal and limit their intake of sugar and refined carb are less likely to become overweight and develop diabetes. Get moving. Regular exercise is important for preventing diabetes. Organized sport or neighborhood pickup games are great ways to get kids moving and active. Limit television time and encourage outside play instead. Maintain a healthy weight. Healthy diet and exercise habit can help children maintain a healthy weight. It's also important to set a good example for children. Be active with your child and encourage good habit by demonstrating them yourself. So that's all about the diabetes in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. Please check it out from there. So that's all. We will definitely meet in the next video. Please do like, share, subscribe this video with your loved ones so that they will get to know better. So this is Carrie Anderson signing off. Please do take care of your health. God bless you. Bye-bye and take care.